All right. So we're gonna go over the health and physical assessment of adult client Q&A questions. Question 1. A client who does not speak English arrives at the triage desk in the emergency department and states to the nurse that an interpreter is needed. Which is the best action for the nurse to take? A. Have one of the client's family members interpret. B. Page an interpreter from the hospital's interpreter services. C. Have a triage receptionist who speaks the client's language interpret. Or D. Obtain a translation dictionary in the client's language and attempt to triage the client. Correct answer is B. Page an interpreter from the hospital's interpreter services. Question number 2. The nurse is performing a neurological assessment on a client and notes positive Romberg's test. The nurse makes this determination based on which observation? A. An involuntary rhythmic rapid twitching of the eyeballs. B. A dorsiflexion of the great toes with the fanning of other toes. C. A significant sway when the client stands erect with feet together, arms at the side, and the eyes are closed. Or D. A lack of normal sense of position when the client is unable to return extended fingers to a point of reference. Correct answer is C. A significant sway when the client stands erect with feet together, arms at the side, and the eyes are closed. Third question. The nurse notes documentation that a client is exhibiting Cheyne-Stokes respirations. On assessment of the client, the nurse would expect to note which finding? A. Rhythmic respirations with periods of apnea. B. Regular rapid and deep sustained respirations. C. Totally irregular respiration in rhythm and depth. Or D. Irregular respirations with pauses at the end of inspiration and expiration. Correct answer is A. Rhythmic respirations with periods of apnea. Question number 4. A client diagnosed with conductive hearing loss asks the nurse to explain the cause of a hearing problem. The nurse plans to explain to the client that this condition is caused by which problem? A. A defect in the cochlea. B. A defect in the cranial nerve 8. C. A physical obstruction to the transmission of sound waves. Or D. A defect in the sensory fibers that lead to the cerebral cortex. Correct answer is C. A physical obstruction to the transmission of sound waves. Number 5. While performing a cardiac assessment on a client with an incompetent heart valve, the nurse auscultates a murmur. The nurse documents the finding and describes the sound as which? A. Lub-dub sounds. B. Scratchy, leathery heart noise. C. A blowing or swooshing noise. Or D. Abrupt, high-pitched snapping noise. Answer is C. A blowing or swooshing noise. Question number 6. The nurse is testing extraocular movements in a client to assess for muscle weakness in the eyes. The nurse would implement which assessment technique to assess for muscle weakness in the eye? A. Test the corneal reflexes. B. Test the 6 cardinal positions of gaze. C. Test visual acuity using a Snellen eye chart. Or D. Test sensory function by asking the client to close the eyes and then lightly touching the forehead, cheeks, and the chin. Correct answer is B. Test the 6 cardinal positions of gaze. Question number 7. The nurse is instructing a client on how to perform a testicular self-examination. The nurse would explain that which is the best time to perform this exam. A. After a shower or bath. B. While standing to void. C. After having a bowel movement. Or D. While lying in bed before arising. Answer is A. After a shower or bath. Question number 8. The nurse is assessing a client suspected of having meningitis for meningeal irritation and elicits a positive Brudzinski's sign. Which finding did the nurse observe? A. The client rigidly extends the arms with pronated forearms and plantar flexion of the feet. B. The client flexes a leg at the hip and knee and reports pain in the vertebral column when the leg is extended. C. The client possibly flexes the hip and knee in response to neck flexion and reports pain in the vertebral column. Or D. The client's upper arms are flexed and held tightly to the sides of the body and the legs are extended and internally rotated. Answer is C. The client possibly flexes the hip and knee in response to neck flexion and reports pain in the vertebral column. Number 9. A client with a diagnosis of asthma is admitted to the hospital with the respiratory distress. Which type of adventitious lung sounds would the nurse expect to hear when performing a respiratory assessment on this client? A. Stridor. B. Crackles. C. Wheezes. Or D. Diminish. Correct answer is C. Wheezes. Last question, number 10. The clinic nurse prepares to perform a focus assessment on a client who is complaining of symptoms of a cold, a cough, and lung congestion. Which would the nurse include for this type of assessment? Select all that apply. A. Ausculting lung sounds. B. Obtaining the client's temperature. C. Assessing the strength of peripheral pulses. D. Obtaining information about a client's respirations. E. Performing a musculoskeletal and neurological examination. Or F. Asking the client about a family history of illness or disease. Correct answers are A, B, and D. A. Ausculting lung sounds. B. Obtaining client's temperature. And D. Obtaining information about the client's respirations.